I'm very pleased to share with you some of our developments in minimally invasive and non-invasive medicine, some of our gains and benefits from minimally invasive and non-invasive medicine, and also a retrospect of the past 100 years and looking to the future. Let's take a look at the history of surgical operation. Over the past 200 years since the open surgery, the first generation was represented by open surgery, second generation MIS, and third generation represented by super minimally invasive surgery or non-invasive surgery with high intensity focused ultrasound. Over the past 200 years, surgery has been first performed by the Western people with the barbers. That is why the color red, white, blue, and white represents veins, and also the history of the surgery. In that time, speed is the key. You can see this is a very fast surgeon. He is quite fast, but there was an operation with a mortality rate of 300% mortality. The patient died, the assistant died, and the people observing died. So we couldn't trace back to the first real operation in the history, and the first surgical operation in the pure sense cannot be verified, and the suture of ancient humans may be the origin of surgery, and the first recorded elective abdominal surgery was completed by American McDowell in 1809, and there were countless forced cases around the world involving liver, heart, lung, kidney. And then the foundation of anesthesia, disinfection, and hemostasis surgery has gone out of the wilderness area and enter into a more formal area. But surgical treatment has been reported with pain and quite complications. Are there any surgical methods that can not only solve the patient's pain, but also reduce the injury to patients? The appearance of cavity mirror technology makes a hope come true. So the laparoscopy made it a reality. There have been stages of development. As surgeons should be really proud of, and the internal medicine also should take some pride in this endeavor. And the German surgeons has played a very important role. As you can see from here, the first case was performed by a gynecologist. He used laparoscopy for the first intra-abdominal disease. And there were some periods between 1940 to 1970. There has been stagnant development of laparoscopic development, and in 1980, German doctor performed the first appendectomy, which is widely condemned. And after that, we usher in the fourth stage in the early 1980s. The combination of electronic endoscope and television revolutionized the way of laparoscopic surgery. Philippe Franco's and Jacques became the first French trilogy that accelerated the development of laparoscopic surgery. Back in the year 1991, before Hong Kong returned to China. At that time, Professor Chen from the Chinese University of Hong Kong and Professor Liu Yanming actually completed the first laparoscopic cholecystectomy in the mainland. The development of endoscopic surgery has gradually replaced part of the traditional conventional surgery with the expansion of the application scope the increase of the surgical methods, the improvement of quality, its development has been on the right track and rapidly popularized. And endoscopic surgery has become an important measure and indicators to the level of surgery. It can, on the one hand, protect many of the organs, but a small incision, but a big trauma or injury still become the pain points for endoscopic surgery. You can see that HAS, the hand-assisted laparoscopic surgery with quite a lot of injuries. How about the small incision and less internal injuries? Is there any way that can cure the disease with less damages? Here comes the minimally invasive and non-invasive medicine. The American doctor Lin proposed the concept of focused ultrasound surgery. Hypothesis that can we target the tumor tissue without impeding the normal function of the other organs at risks. So Professor Frey brothers of Indiana developed the first prototype for HIFU, the predecessor of HIFU, and then Professor Wang Zhibiao's team has made further strides in developing the first focused ultrasound ablation surgery in 1990 and got CFDA approval in 1995 and CE certification in 1999. The mechanism is familiar to you all, so I will not elaborate on it. For our hospital, we have focused on the development of HIFU knife. At that time, we were skeptical. Only in the year 2000, when HIFU was launched after 12 years, we finally introduced this first one in a manner of scientific research collaboration. I myself joined the review panel who focuses on the safety and efficacy. I have done 2 MRI before and post surgery, and we have gained quite a lot of imaging films. As you can see, before operation, 24 hours post surgery, 6 months later, 18 months, you can see that the lesion has almost gone. This has validated the safety, efficacy, and the scientific application. As we have verified its safety and efficacy, we further expanded it. By the end of June the 30th, we have completed 1,683 cases, majority of gynecology cases, where we have majority of cases for the uterine fibrosis and some cases of adenomyosis. And we decided to further expand on other indications to liver, pancreas, cervical cancer, and also orthopedics. And we in total had just 1% of complications reported for such a big samples, just one case of second-degree burning. And there has been obvious pharmacoeconomic value. For this, pharmacoeconomic value is very obvious. You can see there's no need for daycare services. For the other open surgery patients, they need to ask for a sick leave. They need a daycare people to assist their daily life. For Professor Long, he echoed that, is it okay to cut less or cut little or even cut none? For this, in the year 2007, I had a snapshot of his presentation then. we can see that for the hysterectomy comes with a lot of complication reports. For HIFU, its clinical application can effectively solve the volume of the hysterectomy and also side effects and complications. The technology has been widely endorsed and recognized. Now, 150 indications have been approved and reported. How about the future of minimally invasive medicine? Through my 4 decades of clinical experiences, I believe that non-invasive technology may have been the main trend of the future minimally invasive, non-invasive medicine. It has been quite widely embraced, and it has been quite focused by many experts. This is Professor who is a leading professor focusing on the minimally invasive, non-invasive medicine. He said that non-invasive technology is a very effective and a curative solution while preserving the function of the organs and tissue. So, the high-intensity focused ultrasound is one of these technologies with great future. For the past 200 years, the application of non-invasive technology has been getting more popularity. And the high-intensity focused ultrasound ablation technologies are proven to protect the organ at risks. And for our hospital, through the application of non-invasive technology, we have been greatly developing our disciplines and subjects where we have been approved as part of the National Key Laboratory, and we have involved in the basic studies and researches of minimally invasive and non-invasive medicine. Also, we have been part of the fundamental research for the cervical and breast cancer, and we have published quite a lot of papers with major science and technological advancement awards. And we have established 2 kind of associations for minimally invasive and non-invasive medicine, and also the minimally invasive surgeons association. Every year, we usher in hundreds of experts visiting us and learn from us. Hundreds of doctors from abroad come to visit us and learn from us. We have become a role model and demonstration base for minimally invasive, non-invasive medicine. At the beginning, we were skeptical, and now we're fully convinced. Our work has been quite focused by the State of Council and also over CCTV, where they have spent half an hour of footage on the reporting of our story. For minimally invasive, time has been around us. The first 100 years was concluded by the joint work by gynecologists and surgeons, which was represented by the laparoscopy development. And the second 100 years have been driven by surgeons, where it is the application of the minimally invasive and non-invasive medicine, for which Mr. Wang Zhibiao, Chen Zhang Lian, where we focus on integration of internal medicine and the surgical procedures. We believe that non-invasive technology represented by high-intensity focused ultrasound is an important direction of medical development. The non-invasive technology may be an innovation that changes the rules to focus on the development of minimally invasive medicine. may all open up new door to the development of the hospital, for which Swimming Hospital has established the Swimming branch of the state P1 laboratory of ultrasonic ablation technology. And as a training center, we provide training for over 30 countries. At the hospital level, minimally invasive research and treatment center was established and put into operation. You can see that we have 4 operating rooms, surgery rooms, where we have established the surgical access, waiting area, medical staff passageway, and pre-operative preparation area, post-operative observation area. Those are our newly decorated HIFU center. This is our brand new hospital. I believe our new hospital has been put into full operation, will be put into full operation. When that day comes, it will become a demonstration window for HIFU technology. This is our laboratory testing center. This is our endoscopy center. You can see this is a hybrid surgery room in combination with CT and DSE. This is a HIFU center. Room number 1. Operating room number 2. Number 3. This is our staff center. This is our media center, a gym for the staff, cafeteria, academic report center. This is our meeting lounge, outpatient lobby, international conference center, which can accommodate 500 guests. We have actually in the future of the micro minimally invasive industry. Welcome to Sydney with 1,500 years of history.